University hospitals of Derby and Burton have been doing lots of work to improve the experience of patients, including the introduction of Sip Till Send, which changes the length of time you can drink water before your surgery. Sip Till Send has been introduced as drinking water before your operation or procedure, improves patient comfort both before and after surgery. It allows patients to drink sips of water up until the patient is sent for their procedure. This applies to most surgical or medical inpatient and outpatient areas, although certain areas, such as the children's wards, will have a slightly different policy in place. Sip Till Send allows you to sip small volumes, around 170 millilitres, of water every hour before your procedure. This is the volume of a small plastic cup. Please do not use your own bottles or containers, as we cannot measure these.
So the anaesthetist said that you can have a cup of water, so one of these every hour before your surgery. Okay.
In some cases, Sip Till Send may not be appropriate due to medical or surgical reasons. In this situation, the clinical team will advise the ward staff that you should follow different fasting instructions. This may include being allowed to moisten your lips and mouth with water. All other patients, both planned or unplanned, are encouraged to Sip Till Send, but not forced to do so if feeling unwell. It is important to follow this guide for drinking water to prevent any delays to your procedure. By following no more than 170 millilitres of water per hour, you will be ready to go to theatre at any point you are called for. It is important to note that Sip Till Send does not change instructions for food, milk, chewing gum, hot drinks, fizzy drinks, baby milk, or other fluids before your procedure, for which the 6-hour or 2-hour timeline still applies.
I've had a look through Kate's notes.
Okay.
And we're happy to proceed.
Patients should take all their usual medication prior to their procedure, unless otherwise advised. This has not changed from the previous guidance, but in the past, inpatients who have been nil by mouth have often not received important medications such as analgesia, heart medication, and medication to treat Parkinson's disease. Some blood pressure treatments, for example ACE inhibitors, those are drugs ending in prils and sartan, and diabetic medication may be omitted. This will be advised prior to the procedure if required. Hospital audits carried out by several NHS trusts are continuing and demonstrate that Sip Till Send is introducing the following benefits with no increased risks. Improved experience while waiting for your procedure, reducing levels of thirst, making it easier to cannulate, optimising wound healing, and supporting breastfeeding. For further information about Sip Till Send, please contact your clinician.